Many people think of sleep as nothing more than rest, a period when the body simply pauses activity until morning. But modern medical research shows something different. During sleep, the human body does not become inactive. In fact, several biological systems increase their activity during the night. These systems help regulate immune function, metabolic balance, and neurological maintenance. One example is the brain's waste clearance process. Researchers studying sleep and brain physiology have observed that certain metabolic byproducts produced during waking hours are more effectively cleared from the brain during deeper stages of sleep. Other systems also change their behavior overnight. Hormones that regulate inflammation, tissue repair, and immune signaling follow circadian rhythms. These rhythms influence how the body restores balance after daily stress, physical activity, and environmental exposure. Because of this, scientists increasingly view sleep as a critical window for physiological regulation rather than passive rest. At the same time, many wellness discussions have begun focusing on whether certain behaviors or products can enhance the body's nighttime recovery processes. Some of these claims are grounded in research, others are not. To understand the difference, it is important to examine what science has actually confirmed, what experts believe may be possible based on emerging evidence, and what remains speculative. Only then can we separate evidence-based health information from popular assumptions. Conversations about health and wellness often spread quickly online. In many cases, ideas about natural remedies or traditional practices circulate widely before they are carefully examined through scientific research. One example involves the belief that certain topical oils or traditional treatments can dramatically accelerate the body's detoxification, immune response, or overnight healing processes. In many online discussions, these claims are presented as established biological facts. However, the scientific picture is usually more nuanced. In medical science, the term detoxification has a specific meaning. It refers primarily to the body's natural metabolic processes carried out by organs such as the liver, kidneys, lungs, gastrointestinal tract, and skin. These systems work continuously to process metabolic byproducts and environmental substances. According to the National Institutes of Health, UNIH, and the World Health Organization, WHO, the body's detoxification processes are largely regulated internally through enzymatic pathways, circulation, and organ function, rather than through single external products. Another common misunderstanding relates to the lymphatic system. The lymphatic network does help regulate immune responses and fluid balance, but it does not function as a simple toxin drainage system, as it is sometimes described in popular wellness content. Instead, it is a complex transport and immune surveillance system that moves immune cells and proteins throughout the body. Confusion also arises when traditional or historical remedies are discussed alongside modern scientific explanations. Many plant-based oils and extracts have been used for centuries in different cultures for skin care, massage, or digestive support. These historical uses provide valuable cultural context, but they do not automatically confirm specific physiological effects. For this reason, healthcare professionals typically distinguish between traditional use, early research, and clinically proven outcomes. Understanding these distinctions helps prevent oversimplification. It also allows people to appreciate both historical practices and modern medical evidence without assuming that every claim circulating online reflects confirmed biological mechanisms. Understanding how the body maintains internal balance during sleep and recovery requires looking at evidence from established medical research. Several large health organizations and peer-reviewed studies have explored the biological systems often mentioned in discussions about detoxification, immune function, and tissue repair. One area that has been well studied is the role of sleep in neurological maintenance. Research supported by the National Institutes of Health has examined a brain-wide clearance pathway known as the glymphatic system. Studies conducted in laboratory models and human imaging research suggest that this system becomes more active during deep sleep phases, allowing cerebrospinal fluid to circulate through brain tissue and remove certain metabolic byproducts. While this research indicates that sleep supports neurological maintenance, scientists emphasize that the glymphatic system is only one component of a broader physiological process. Long-term clinical research is still ongoing to determine how variations in sleep quality affect neurological health across the lifespan. Sleep also plays an important role in immune regulation. The World Health Organization and the Centers for Disease Control and Prevention Both identify adequate sleep as a key contributor to immune system stability. Research published in peer-reviewed journals has shown that immune signaling molecules, including cytokines, follow circadian rhythms. During sleep, certain immune processes related to pathogen recognition and immune memory formation become more active. However, these changes occur naturally as part of the body's internal regulatory systems. Current clinical evidence does not support the idea that a single topical substance can dramatically amplify immune cell production overnight. Regarding plant-derived oils, several studies have evaluated compounds found in Ricinus communis, the plant from which castor oil is extracted. Castor oil contains a fatty acid called ricinoleic acid. Laboratory research has shown that ricinoleic acid may have anti-inflammatory and skin conditioning properties when applied topically. For example, small studies cited in dermatological literature suggest that plant oils rich in fatty acids may help support the skin barrier by reducing moisture loss and improving surface hydration. These effects are consistent with how many emollient oils function in dermatology. At the same time, major health organizations emphasize that most evidence involving plant oils relates to skincare or digestive uses, rather than systemic detoxification or immune activation through topical application. In evidence-based medicine, researchers distinguish between different types of studies. Laboratory experiments may identify potential biochemical effects, observational studies may detect associations, and randomized clinical trials are used to determine whether an intervention produces measurable health outcomes. In the case of many traditional remedies, including castor oil, some biological mechanisms have been studied, but large-scale clinical trials evaluating broad systemic health claims remain limited. Because of this, most medical guidelines encourage cautious interpretation of wellness claims until stronger evidence becomes available. To understand how substances applied to the skin might interact with the body, it is helpful to examine the basic biological systems involved. These include the skin barrier, the circulatory and lymphatic systems, the immune system, and the body's neurological and hormonal regulatory networks. The skin itself is not simply a protective covering. It is a biologically active organ composed of multiple layers. The outermost layer, called the stratum corneum, functions as a protective barrier that regulates water loss and prevents many external substances from entering the body. This barrier is composed primarily of keratinized cells and lipid structures that tightly control permeability. Because of this structure, most substances applied to the skin remain on the surface or interact mainly with the upper layers of the epidermis. Some small molecules and lipid-soluble compounds can penetrate partially into deeper skin layers, which is why certain medications can be delivered through transdermal patches in clinical medicine. However, these patches are carefully engineered to control dosage and absorption. Plant oils, including castor oil derived from Ricinus communis, contain fatty acids that interact with the lipid structures in the skin barrier. One of the primary components is ricinoleic acid. Laboratory research suggests that this fatty acid may have mild anti-inflammatory and moisturizing properties when applied to the skin. These effects are generally related to how oils influence skin barrier function. When applied topically, certain fatty acids can help reduce transepidermal water loss, which means they help the skin retain moisture. This process can improve skin hydration and may contribute to smoother skin texture over time. In addition to skin barrier interactions, the body's inflammatory response involves signaling molecules known as prostaglandins. Some experimental studies have explored whether fatty acids may influence inflammatory pathways associated with prostaglandin signaling. These findings primarily come from laboratory or animal research rather than large human clinical trials. As a result, researchers view these mechanisms as areas of ongoing investigation rather than established therapeutic effects. Another system frequently mentioned in discussions about detoxification is the lymphatic system. The lymphatic network is responsible for transporting lymph fluid, which contains immune cells, proteins, and cellular waste products. This system works alongside the circulatory system to maintain fluid balance and support immune surveillance. Unlike the bloodstream, the lymphatic system does not have a central pump like the heart. Instead, lymph movement is influenced by several factors, including skeletal muscle movement, breathing patterns, and pressure changes within tissues. For this reason, physical activity, posture, and hydration are known to influence lymph circulation. Sleep also plays an important role in systemic regulation. During sleep, the body shifts toward parasympathetic nervous system activity, often described as the rest and recovery mode of the autonomic nervous system. This shift affects heart rate, digestion, hormone release, and immune signaling. Hormones such as melatonin and cortisol follow circadian rhythms that influence inflammation, immune function, and tissue repair. When sleep is disrupted or chronically insufficient, these regulatory cycles can become imbalanced. Research from the National Institutes of Health has shown that sleep deprivation may affect metabolic regulation, immune responses, and neurological health. It is also important to recognize that many biological systems operate through complex interactions rather than single mechanisms. Skin health, immune function, digestion, and neurological regulation involve coordinated activity across multiple organs and signaling pathways. For this reason, researchers generally evaluate potential health interventions within the context of the entire system. While topical products may influence localized skin conditions or comfort, broader systemic effects require strong evidence from controlled clinical research. Understanding these biological foundations helps place many wellness claims into perspective. The body's regulatory systems are highly sophisticated, and meaningful health outcomes typically arise from a combination of lifestyle, environmental, and physiological factors rather than from a single intervention. When scientists evaluate health interventions, they usually focus not only on immediate effects, but also on long-term outcomes related to overall health and quality of life. These outcomes are often discussed in terms of risk reduction, functional capacity, and the balance between health span and lifespan. One factor that consistently appears in long-term health research is sleep quality. Public health research reviewed by organizations such as the World Health Organization and the Centers for Disease Control and Prevention indicates that chronic sleep disruption is associated with increased risk of several conditions, including metabolic disorders, cardiovascular disease, and reduced immune resilience. These relationships are based largely on observational studies and long-term population research, meaning they show associations rather than direct cause and effect relationships. Maintaining healthy sleep patterns appears to support multiple biological systems simultaneously. Adequate sleep contributes to stable hormonal cycles, balanced inflammatory responses, and improved cognitive function. Over time, these processes may influence how well the body adapts to environmental stressors and maintains physiological stability. Skin health also reflects long-term biological regulation. Dermatological research has shown that maintaining the skin barrier and preventing excessive moisture loss can help reduce irritation and support tissue integrity. Moisturizing agents, including plant-derived oils, are commonly used in skincare for this purpose. However, their benefits are generally associated with local skin hydration and barrier support rather than systemic health changes. Another long-term consideration is immune regulation. The immune system adapts over time through repeated exposure to environmental factors, vaccinations, and normal immune signaling processes. Lifestyle factors such as balanced nutrition, regular physical activity, stress management, and inadequate sleep are widely recognized as contributors to immune resilience. Importantly, most long-term health outcomes are influenced by a combination of behaviors rather than a single product or practice. Medical research often emphasizes patterns of behavior across months or years rather than isolated interventions. For individuals interested in supporting their long-term health, the most reliable strategies tend to focus on consistent lifestyle habits that align with well-established physiological principles. When evaluating health practices, medical professionals often rely on consensus statements and clinical guidelines developed by large public health organizations and professional medical associations. These guidelines synthesize findings from multiple studies and help identify areas where evidence is strong, where research is still evolving, and where evidence remains limited. There is broad agreement among major health organizations that several lifestyle factors play a central role in maintaining physiological balance. The World Health Organization, the Centers for Disease Control and Prevention, and the National Institutes of Health consistently emphasize the importance of adequate sleep, balanced nutrition, regular physical activity, and stress management. These factors have been supported by large population studies and long-term public health research. In dermatology, professional organizations generally agree that maintaining the skin barrier is an important part of skin health. Moisturizers and emollient oils can help support hydration and reduce dryness in certain individuals. Dermatology guidelines typically recommend products that are well tolerated by the skin and free of irritating additives. At the same time, experts also acknowledge areas where research is still developing. Some laboratory studies have examined the biochemical properties of plant-derived compounds, including fatty acids found in oils extracted from Ricinus communis. These studies suggest potential anti-inflammatory or skin conditioning effects, but large clinical trials examining systemic health outcomes from topical use remain limited. Because of this, most medical organizations advise caution when interpreting broad health claims associated with single products. While traditional practices may offer cultural or personal value, professional guidelines generally prioritize interventions that have been tested through controlled clinical research. This approach allows health recommendations to evolve as new evidence becomes available while maintaining a focus on safety and scientific reliability. When translating health information into everyday habits, public health guidance usually focuses on safe, broadly applicable practices rather than specific treatments. The goal is to support general well-being while recognizing that individual health needs can vary. For skincare, maintaining the integrity of the skin barrier is widely recommended. Dermatology guidance often suggests gentle cleansing, adequate hydration, and the use of moisturizers or emollients that help reduce excessive dryness. Plant-derived oils may function as occlusive moisturizers for some individuals, meaning they can help slow moisture loss from the skin surface. However, skin responses vary, and products that work well for one person may not be appropriate for another. Sleep habits are another area where consistent routines can support overall physiological regulation. Health organizations encourage maintaining regular sleep schedules, reducing exposure to stimulating light before bedtime, and creating an environment that supports uninterrupted rest. These practices help reinforce circadian rhythms that regulate hormone production, immune signaling, and neurological recovery. Physical activity also plays a role in several biological systems discussed earlier, including circulation and lymphatic movement. Moderate daily movement, such as walking, stretching, or light exercise, can support normal fluid circulation and musculoskeletal health. Individuals interested in using traditional or natural products for personal care may benefit from discussing these choices with qualified healthcare professionals. A clinician can help determine whether a product is appropriate in the context of a person's skin condition, allergies, medications, or other health considerations. Approaching health practices through a combination of reliable information and professional guidance can help ensure that personal wellness decisions remain both safe and informed. Health information often spreads quickly, especially when it involves natural remedies or long-standing traditions. While some practices may have historical roots or promising early research, understanding how they fit into modern medical knowledge requires careful evaluation. Scientific research continues to reveal how the body regulates sleep, immune activity, inflammation, and skin health through complex and interconnected systems. These systems function through coordinated biological processes that evolve over time, influenced by lifestyle patterns, environmental factors, and genetics. Evidence-based health decisions are rarely built on a single product or technique. Instead, they emerge from consistent habits supported by credible research and professional medical guidance. For individuals interested in improving their overall well-being, focusing on established foundations, such as sleep quality, balanced nutrition, regular movement, and appropriate skincare, remains one of the most reliable approaches. Staying informed, asking thoughtful questions, and seeking guidance from qualified healthcare professionals can help people navigate health information with confidence. As scientific knowledge continues to grow, maintaining a balanced perspective allows individuals to benefit from both emerging research and well-established medical understanding. This content is intended for general educational purposes only and should not be interpreted as medical advice, diagnosis, or treatment. Health information presented here reflects current research and public health guidance, but may not apply to every individual situation. Medical conditions, medications, allergies, and personal health history can influence how the body responds to different products, practices, or lifestyle changes. Individuals should consult a qualified healthcare professional or licensed medical provider before making significant changes to their health routines or using new products, especially if they have existing medical conditions or concerns. Reliance on any information provided in this content is solely at the viewer's own discretion and should be considered within the context of professional medical guidance.